Good evening. The health risks and harsh reality of Canada's ER crisis are being laid bare tonight with stories of agonizing wait times. As provinces try to adjust to help alleviate pressures, there is concern the problem is trending in the wrong direction. CTV's Colton Praill starts us off.
Frankly, they're so busy, I got forgotten quite a few times.
Andrea Harden says it took 37 hours from the moment she entered the emergency room in Ottawa until she finally had surgery for appendicitis the next day.
It's incredibly frustrating, and it was very painful, frankly, in a really hard time in my life.
Harden spent the night in a reclining chair in a hallway, unable to sleep, surrounded by other patients and medical staff that were struggling to keep up.
To feel it and to see it and to hear the code whites and to see people running around and see people in pain in hallways, to be a person in pain in hallways, that made it so much more real on a very different level.
Across the country, wait times on Saturday at major hospitals in Toronto, Montreal, and PEI were at least 5 hours, while adult patients at Winnipeg's Health Sciences Centre waited an astonishing 7.5 hours. This doctor calls it a crisis.
Canadians have lost confidence that their healthcare system will be there for them when they need it. And I think we as healthcare providers have lost confidence in our political leaders that they actually know what they're doing and have a way forward. I don't think they do.
Manitoba has announced new short-term staffing to ease the burden in that province. New Brunswick hopes to open more beds by moving long-term care patients out of hospitals after declaring a critical state procedure. Increasingly, doctors say patients are being seen in hallways and ambulance bays.
Many times I'm seeing patients on EMS or paramedic stretchers, not actually in the ER, but outside the ER, because there's actually no room in the ER for paramedic stretchers.
More needs to be done, because I would hate for more people to go through what I went through, and I know it's going to continue happening, and that's frankly scary. I think we need to do something more, and governments absolutely are behind the ball and need to act.
The health minister's office says they're having active, productive conversations with the provinces to sign more bilateral healthcare funding deals. But after Ottawa offered up $196 billion last spring, so far only 4 provinces have signed on. Heather.
Colton, thank you.